again. There are mental health clinics, listen carefully, mental health clinics providing skin substitute placement on their patients. Again, you're dealing with ulcers in a mental health clinic. These services are provided by an anesthesiologist. Improbable. Money's not leaving the building. You're going to have to prove to me that there's a clinical benefit of a psychiatrist telling an anesthesiologist to put a surgical graft on a patient. It's not going to happen. We need your help. That's my big plea. We need your help, the American people. Why? Over half of the whistleblower tips that we get are for healthcare fraud, and over half of the fraud against our government is in healthcare. So we need your help, both to protect your own important information. Don't give it away because con artists come to your door and try to get it, but give us tips. You're going to hear all of us share opportunities that we have, but it only happens in healthcare because we know we have allies, the American people. We provide care to 68 million Medicare beneficiaries. 80 million Americans are on Medicaid or CHIP. There's another 20 million on the exchanges. There are a lot of people that will come to help us. So write this down, 1-800-HHS-TIPS. 1-800-HHS-TIPS. We have a URL, obviously, if you go to our website as well. And I'll leave you with one last thought. In addition to the massive fraud, especially from foreign entities trying to invade America using their financial tools and criminal mindsets, we also have 25% of all of our money being spent probably subject to abuse. And that's not fraud. This is abuse and waste. Money not being used wisely. We just launched a new model called Wiser with the Centers for Medicare Medicaid Innovation under Abe Sutton that is looking at ways for us to identify inappropriate use of services that are wasteful and should not be offered to the American people because they could hurt them. And they're certainly not providing value for these wonderful Americans whose health is being taken advantage of to generate higher savings, higher revenue, rather, for providers. We're not going to tolerate it anymore. We're going to use data analytics, real-time monitoring, and unhesitating, unwavering pursuit of the law to make sure this happens. I want to thank my colleagues on the stage and their agencies for all the wonderful work you have done. God bless you.